Hi, my name is Norma DeLara, and I'm a breast cancer survivor, designer of the IC compression garment made by a patient for patients. So when I was diagnosed with breast cancer, I went to visit my doctor, my breast surgeon, with my husband, and I learned that I had the option of a lumpectomy. I had one lump in the left breast. I had the option of lumpectomy. I had the option of removing one breast or removing both breasts. And I decided immediately I wanted to remove both breasts. So the idea of the cancer coming back in the other breast, I had to eliminate. And aesthetically, I didn't want a 60-year-old boob and a 37-year-old boob. So to me, it just made sense to remove both breasts. And I woke up in agony. My arms were sore, my chest was tight, I was uncomfortable. I was sick from anesthesia, and I felt paralyzed. I felt absolutely paralyzed from the waist up. The doctors told me, for comfort and for swelling, to apply ice to my chest. Not directly onto my skin because I had this bandage, but over this piece of material, they asked me to put ice onto my chest and do that several times a day to help with relief, and to do that for several times. And I had to do this not just after the mastectomy, but with my 3 reconstruction surgeries, my 3 fills of expanders. So it was a process that I became very well aware of. I remember my 3-year-old one time needing me, and it was right after one of my fills of my expanders, and it was just agonizing, the pain. And I had to put ice, but my boy needed me, so I had to get up and hold them. And so you kind of hold it in place, move one hand. It wasn't the easiest job to do. And the actual feeling of holding it, you're using those muscles. So everything about it was painful, everything about it was uncomfortable, everything was just a reminder of my inconvenience that a lump had already started to be due to my life. This first garment, this is what I wore when I woke up. This is what I wore for 3 reconstruction surgeries, what I wore after my mastectomy, and I was very irritated. The feminine ruffles actually were it was so obvious that something was underneath my clothing. I'm not a large frame woman. My shirts that I wore, no matter how large of a shirt I wore, it was obvious that there was this rigid item under me, and it fit, it would slide. This top portion here just felt kind of choking. I didn't have any relief from the top. But most importantly, the ruffles was the most disturbing portion of it. Everyone knew that I had this on, and everyone knew when I took it off. It was just very loud. It was obnoxious. This other garment, it's more like a tube top. It's very smooth. It's discreet underneath. And then the idea that I was able to hold ice here. You see, I couldn't move my arms. So having something that I was able just to cross my hands to put some ice was easy. It was safe for me to do. But most importantly, it didn't limit. I already felt limited to begin with. And not being limited, I had to apply ice. I had to help with the swelling, but I couldn't just sit there. And it's very lightweight. What I would tell a breast surgeon that, yes, I'm alive and I want to live a life. I was 37 years old. 41 and I've been fighting breast cancer for 3 straight years. And what I would want a breast surgeon to know is I live after the surgery is over. And anything that I can have or do that can be a little bit more comfortable, a little sense of normalcy, a little bit of feeling like a woman, I was having my dignity, having a little bit of dignity afterwards, that it's more than just a body on a surgical table. It's what I would want them to know. This design was made accidental, but with intent. Accidental because, you know, it was by accident that a patient has to have cancer. It's not intentional. But the design makes it different because you have to go through things in life. There's something about experience. You know, you can study and study and study, but experience is something that you cannot replace. And until you have to walk in someone's shoes, can you think of the other person? Can you have empathy? Can you have an understanding? They tell you walk in someone's shoes, and then you have an you then know what it's like. So the design is unique because the person walked that walk. And in walking that walk, felt and understood what so many other people were going through before them, and so many other people would have to go through after them. And so if something as simple as getting a piece of toast for your toddler, and still try to add comfort for you, that helps. Being able to go outside and not everyone look at you as a patient, felt, it felt great.